All right, so now it's time for us to have some questions and answer. If there's additional questions that people would like to ask, or if you have a card, we can pick those up. Does anybody have any questions? Mike?
Just to follow the question about how can the public participate more, these contracts that you mentioned sound reasonable, but it is Medicaid money. That's our money. So that's a plug, I think, for figuring ways and inviting us to come to that decision-making process in some way. Now, there's a meeting that you invited me to, we talked about,
Yep.
the fourth Thursday.
Yep. So what he's referring to is we have what's called our Delivery System Transformation Committee. It meets every other week, and Kim is actually the chair of that. So I'm going to have her just give a summary of what it is, so that you can have that in your pocket for the next time. Okay.
Well, and I also wanted to clarify. So Bridget, can you stand up for a second? Yep. The pilot she was referring to was developed in a public process. The dollars that went to the housing pilot with the navigators was developed at the Delivery Systems Transformation Committee. It's a public process. You can stand now, thanks. It's a public process that's available. We start every meeting saying that this meeting is open to anybody who can improve the healthcare outcomes of an IHN CCO member. We welcome people to come, but the participation really is for those who can affect the health outcomes of our members. We have rules that you have to have been there 5 times in the last 6 months to be able to vote on any decisions. We spend the months of January and February working with people from the state of Oregon Health Authority, who provide guidance in helping us determine our scope for decision making. We're in that process right now. Then we spend the rest of the year focusing on how do we transform healthcare in order to reduce the costs, increase the access, and improve the quality. And that is our focus. And so last year, was your pilot awarded funds last year? Late 2015. The funding that we have is dependent on the dollars available. So unfortunately this last year, we weren't able to have a second round of funding because the dollars weren't there. So we have to take this year 1 month at a time and see if we have dollars. But the group that comes is very committed. The focus isn't about necessarily funding projects. It's about coming together as a community to talk about how do we transform healthcare. How do we generate good ideas? How do we distribute good ideas? And how do we collaborate on good ideas? So, and it's every other Tuesday, 4:36. Oh, Thursday. Sorry, thank you. It's not today and it's not tomorrow, okay? The next meeting is February 27th. The February 27th is the day we're going to have the facilitator from the state come and help us work on scoping our strategy. So that's Thursday, and then 2 weeks from then, it'll be the next Thursday, right? So, and then it's every 2 weeks on a Thursday from 4:30 to 6. Yes. I just want...
Yeah, where again?
Oh, where? It's at the Walnut building of Samaritan Health Plans. Right there across from Winco, right? It's in that corner. Okay, and you just have to walk in the front door and say you're there for the Delivery Systems Transformation Committee.
It's at 4:30?
It's at 4:30, right. So I just wanted to clarify that the dollars that went to the non-emergent medical transportation were part of a proprietary provider contract. Once we sign a contract with a provider, those dollars are no longer ours. So they belong to the provider, they earned those dollars. And that's why that's not a public process, because it's not our dollar anymore. So, any other?
Has any thought by IHN CCO been given towards thinking about addressing bed bugs? I'm not sure if it's a strong enough nexus to
bed bugs.
Healthcare, but
I wish we could solve that. My son lives in bed bugs at Portland State University. I am so into solving that problem, because he can't come home until I solve that problem. I mentioned the state of Oregon coming to help us scope how we look at this. And so we, under our contract with the state of Oregon, we have to focus on the 8 elements of transformation. That includes alternative payment methodologies, the development of primary care homes, the integration of dental health and mental health into physical health, quality incentives, health equity, non-discrimination, EMR, electronic medical records, right? The other thing that we need to focus on is our community health improvement plan. So in our meetings, we not only focus on the 8 elements of transformation, we also bring in the elements of the community health improvement plan that we as a CCO collaborate on with our community advisory councils. We also are focusing on the metrics that bring in extra dollars into our communities. If as a CCO and as a provider community, we achieve certain metrics, we get money from the state to reinvest in our programs. And it's actually under that model that we are then developing our own alternative payment methodology with providers.
But I don't think bed bugs have been brought up as an issue.
Well, bed bugs would have a hard time finding a nexus in those,
well,
right?
I mean, like,
Yeah.
you can just,
Yeah.
I mean, like, if housing affects
Yeah,
health,
sure.
bed bugs leave, like anybody with mental
Right.
health issues, generally they're the ones
Sure.
that are going to be evicted for bed bugs.
Well, and you hit the nail on the head. The issue, and this is why we have the Oregon Health Authority coming in and helping us scope the conversation, because when you think about what affects a health outcome, everything affects health outcomes. We talk about social determinants of health affecting health outcomes. That's housing, food, security, connectedness in your community, your social relationships, where you live, how you live, all those pieces. And so it doesn't end. And as a community, in order to be effective and move forward and make change, we have to align around common agendas. That's really difficult. And so that's why we have the state coming in to really help us scope. And to date, bedbugs has not been in that narrow scope. That's aligning us and moving us together. Not that it's not important, it is, because we can connect the dots everywhere.
Good question.
Yeah.
What else? What other questions do you have? Yeah.
How are things going with the metrics?
Oh, so the question is, how are things going with the metrics? So we have finished 2016. In terms of that is the calendar year that looks at the metrics that would be available for us to get dollars back in 2017. And we are still working with the state to finalize some of the data, but we're feeling pretty positive and really meeting quite a few of them. We're feeling good about the fact that we will end up very similar to where we did last year, so with a positive outcome, but we won't know for another couple months specifically until all the data is collected by the state. But we are feeling good about that, and I think the most important thing to say about that is that the energy created around meeting those outcomes and the provider community and what they've done to come together to meet those is really gotten momentum over the last year and continues to have that momentum moving into 2017, which will be then improving the outcomes of our members, which is the goal of that. So we're feeling good about those, but we won't have the final information for another few months. Good question. What other questions? Yeah.
Can you talk a little bit about what you see the IHN CCO's role is in addressing the social determinants of health, poverty, housing?
I think a lot of my response to that would be that, again, back to as we've already heard, we have a contract with the state of Oregon to take Medicaid dollars to take care of healthcare services for Medicaid members. There's no question around everything that touches health and impacts health. And so I think as we work with our Community Advisory Council and we work with our delivery system transformation and we make sure that we recognize and do our best to address those social determinants of health, how they fit into the 8 elements of transformation, the healthcare delivery system. Our job is to figure out how to bring those pieces together and recognize those and maximize the resources around to help with that. But we can't, again, back to scope, that's not something that we technically have a contract to pay for, but we recognize from a transformational perspective the value that addressing those brings. So it's not a one-to-one, but it's something that's very much in the forefront and something that we want to work on with our community partners. So it's a hard one. It's kind of like housing, certainly supporting housing, but we can't build housing. We don't have dollars to build housing, but what can we do to collaborate with those housing units and, as we say, build the sidewalks where people are as opposed to where we are. So it's an ongoing area of focus. Yeah.
How do you determine how you're going to spend the money that you may or may either have or be able to get for flexible services?
So we have a flexible services policy that that has been developed and that is approved by the state of Oregon to try and figure out how to use some of those dollars. And so that's part of a lot of the discussion happening at the state level as it relates to the waiver that's just been renewed and how it's not quite as robust as the original waiver that the state had hoped to put through in terms of addressing flexible services, but it does address some of them.
Can that policy be found online?
I'm not sure if it's online, but why don't you write down your information and we can get you, or Kim will give you her card right now and we'll get you some information on that. What else? Dr. Huntington.
What is your per member per month payment for our 60,000 clients now? And how much of that is spent on health care? And how do we find out what's done with the difference between the two?
Sure. So I actually don't know off the top of my head what our member per month is, and unfortunately we don't have 60,000 members anymore. There's been a pretty big decline in enrollment across the state, so we're down to about 51,000 lives on Medicaid in our area. Our rates are actually out on the OHA's website. Our whole entire contract is out on the Oregon Health Authority's website, so you can see the rates. We get a different payment in 16 different eligibility categories based on a person's age or different demographics. And so that is all available out there. As are all of our financial solvencies are posted out there, so you can see everything that was spent and where. I will tell you that we spend, basically 90 to 92% of every dollar on medical services, and we have about 8 to 9% on administrative services, which is what our contract with the state says. And that is all available on the Oregon Health Authority's website. There's a lot of discussion happening at the legislature, which is in session right now, talking about many of the discussions we've had around here in terms of transparency, oversight, and all of those pieces. And so we have been working and attending the Oregon Health Policy Board meetings and looking at the recommendations. Representative Greenlick has stated that he would work with the Oregon Health Policy Board's recommendations on how to incorporate those into actual legislation moving forward. And so we've been working within that process, and agreeing with a lot of the concepts and giving feedback on some of the other pieces in terms of how it would be most effective from our opinion. A lot of some of the pieces in there are actually already in our contract with the state of Oregon, and so clarifying that and making sure that everybody's aware of that is one way to sort of address some of the concerns that are raised. But we are aware of that, and there's many things in there that we do agree with, and there's some things that would be more challenging, and so we've been sharing that. So as a CCO, we are a nonprofit. So we from our perspective, yeah. So we have not specifically taken a position on that statement at this time. Does anybody else want to add anything? For us, that's not an issue because we are a nonprofit and don't plan on changing that. But so we haven't taken a stand per se. Well, I think I certainly can't speak for the other 15 CCOs, but we have been talking, and part of the way that the Oregon Health Authority originally set up and the CCO legislation was written was that each CCO had the ability to, or each area in the state had the ability to go out and create a CCO and contract with the state of Oregon to deliver services. And that contract did not stipulate the status, nonprofit or for-profit or whatever. The theory being, sure, I don't disagree with that. In the end, that is what was there, and so different groups came together and created CCOs in a way that worked best in their own community, and so that's why it's an important discussion that continues to happen. I think given some of the changes that have happened in the delivery system across the state, clearly that's a discussion item. But from our perspective, we are a nonprofit and don't plan on changing that, and so that's where we are at this point. Thank you so much for coming this evening. Have a good evening. Oh.